Well, you might have noticed it is flu season, and a new aggressive strain is emerging as a major health threat. Doctors warning the new variant causes more severe symptoms and a higher risk of hospitalization. Dr. Mark Siegel, Fox News senior medical analyst and author of the #1 New York Times bestseller, The Miracles Among Us, sent a copy to Mercy Ships. Doc, they're going to be able to read it there as well. Sir, tell me a little bit about this severe flu variant. 9 out of 10 influenza A viruses tested, up 89%?
Yeah, this is a big problem. H3N2 is usually already the most severe flu we have. It's an influenza A, and this is a variant off of it. It took over in Australia. We look to Australia because their summer is our winter and vice versa. They just came out of a really awful flu season with about 500,000 cases. And get this, Dana, of those cases, 10% were under 5, and 1/3 were under 15 years old. So it really hit kids very, very hard. And there's a lot of hospitalizations and severe symptoms, and the usual thing you expect, which is you get a lot of fatigue and muscle aches and sore throat and headaches, but it's pretty severe. And this is what we're seeing here in the Northeast, in New York City, in the metropolitan area right now. We're getting hit very hard. And over 10% of all ER visits are now due to this flu. So it's getting up there.
As you mentioned, the symptoms, let's put them up on the board for people. Fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, and fatigue. At what point, if you're having any of these symptoms, should you go to the hospital?
Well, you know, I don't want the ERs to be flooded because this is pretty contagious. So the best thing you can do is call your health provider if you have access to one, because I having written books of flu, I treat this over the phone a lot of the times, and I'll figure out if I should give you Xofluza or Tamiflu. There are medicines that I can use to cut down on severity. The other thing is to get a flu shot. I mean, you know, flu shot is not a great match for this year, but it still decreases your risk of hospitalizations by a lot. And in New York, for example, only 20% of people outside of New York City have taken their flu shot this year. That's not enough.
Is it too late to get a flu shot at this point, or would you say people should still do it?
I'd say now is the time, because it takes about 2 weeks. Generally, flu season peaks in January. It's peaking early this year, but if you take your shot today, you'll have coverage in 2 weeks.
Got it. Okay. Also, let's get to this story, something I pay a lot of attention to, the whole issue around cannabis, medical marijuana, et cetera. There's a new study in the Journal of American Medicine that says the study is finding that cannabis increased risk of psychotic symptoms. 12.4% is a high potency, 7.1% a low potency, and that increased risk of anxiety disorder went up 19% for high potency and 11% for low potency. So it's not like there's not concerns and risks involved.
And President Trump is thinking about changing the scheduling from Schedule 1 to 3, skipping over Schedule 2, where Adderall is. So I would caution him not to do that because of this study. This study looked at 15 years of 2,500 studies that have been done previously, and they've discovered, like you said, increased risk of psychosis, learning problems. And, you know, the most important thing is it didn't show the medical advantages that we supposedly had. It doesn't work for pain most of the time. It interrupts your sleep. And it worsens your anxiety, not decreases it, and again, increases your risk of psychosis and mental health disorders. The negative outweighs the positive, and the reason for that is because the amount of THC in today's cannabis has gone skyrocketing up over 30%.
Even if it's for medical marijuana, is that, I mean, I guess I could imagine that on the street, or maybe you get something at a shop, but if it's prescribed by a doctor?
That is a really good point, Dana. That depends. Okay, the problem is in a lot of states, 40 states where medical marijuana is allowed, you just show a certificate at a cannabis shop and say, look, I have medical authorization. And doctors don't have total control over the amount of THC we're talking about here. It's supposed to be a lot lower. It oftentimes isn't. And and shadow industries grow up in the shadows of this. The cannabis industry is counting on changing the scheduling. I'm concerned about it. And I'm concerned that even with medical marijuana, there's too much THC.
Hey everyone, I'm Emily Compagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.